Hey mama, you are 9 weeks pregnant, which means you are in your 3rd month of pregnancy. Let's talk about what's going on in your body and your baby's body this week. Your baby is about the size of a grape. Their spinal cord, which was once very long and protruded out like that little tail, has now shortened as their little body has continued to grow. Baby has a mouth and tongue with taste buds, and they now pee to add to their amniotic fluid. Now this might sound gross to you, but their pee is sterile, and it's actually crucial they do this because it adds to the volume of their amniotic fluid that they're floating around in and is a sign of healthy kidney function. Now, you might be noticing some changes in your own body, especially when it comes to urination. You might already be peeing a lot more than usual, and this does not mean you should cut back on your water intake. Hydration, like we've talked about before, is super important. So keep drinking between 90 to 100 ounces of water per day and adding electrolytes to your drinks. Try to get your drinks in earlier in the day to prevent waking up every hour at night having to go pee. Now, many mamas wonder about caffeine intake during pregnancy. And according to the leading pregnancy associations like the American College of Obstetricians and Gynecologists and the American Pregnancy Association, a safe amount of caffeine is 200 milligrams per day. However, recent studies in 2020 came out that looked at several meta-analyses and found that there was no safe level of caffeine in pregnancy, and that caffeine intake was associated with higher chance of pregnancy complications. If you want to check that out, I will link it below in the description for you to take a look at and decide what's best for yourself. If you feel like you absolutely need your caffeine, I would encourage you to take a look at why that might be the case. Is it because you're staying up too late and you're not ready for the morning when it comes? Maybe it's time to look at your schedule and rearrange your calendar in this season of pregnancy. Maybe you're sleeping enough, but you're chronically tired. It might be time to get your blood work drawn by a functional medicine midwife who can look for deficiencies that might be causing this intense fatigue. With that being said, the first trimester is especially exhausting. If you need that afternoon or even evening nap or need to go to bed early so that you can function through the day, more sleep is going to be more beneficial than more caffeine. Now, some of you might be telling the world that you're pregnant, while others of you are more secretive during this time. Whatever you choose is valid. Many women feel like they should wait to share about their pregnancy because of the risk of miscarriage. And for those of you who feel this way, I want to encourage you to think about who in your life you would want support and love from while celebrating you or grieving with you. These are the people who are worth sharing your pregnancy news to, and is going to be life-giving and just so special. The beginning of pregnancy can feel a little overwhelming, even scary at times, so having that support system and love from special people around you can be really encouraging. Well, that wraps up week 9 for us. Thanks for being with me in this video, and I will see you next week. Bye!